Hello, everyone. My name is Van Lee, and I'm your host today. You're watching VATV. It's a program supported and sponsored by the Vietnamese American Initiative for Development, otherwise known, commonly known as VATAID. We are on the air several times a week, Sunday at 5, tonight, Wednesday at 7, Monday at 1, and Tuesday at 11 a.m. You can watch us on channel 15 if you have RCN, and channel 9 if you have Comcast. You can call in, believe it or not, 617-708-3290, 617-708-3290. Tonight's program is really about healthcare and about some interesting developments at Carney Hospital. And we're very privileged to have Dr. Glennon O'Grady. If you try to get an appointment with him and you couldn't, well, you can call him right now because I have him. He probably answer your call right now if you call him. But I'm just kidding. We want to ask you some very basic questions. For those of us who have experience with Carney Hospital, I have to share with you. Carney Hospital has been an institution in the Boston area and more locally in the Dorchester neighborhood, but it really serves, Boston, greater Boston area. First, it's located at 2100 Dorchester, kind of near, the Lower Mills area.
Lower Mills area,
okay.
Yeah, right. It's south end of Dorchester Ave.
Right, and it's a full service hospital. I mean, what does it cover?
Yeah, so
what do you have?
We're taking care of adults. We have an emergency room that will see anybody who walks in, full specialties for adult medicine, pulmonary cardiology, and what we're proud of is really regrowth of family medicine, which is new now at Carney, being able to provide primary care from birth through elderly.
Yeah, and how long have you been with Carney?
I started there December 2011, and at that time we didn't have a department of family medicine, but was asked to come down and start a department, and then we started a training program to again build the population of physicians that actually can provide primary care.
Terrific.
This is the first new program in family medicine in over 15 years in Massachusetts.
So just give us a little bit of a history, or a quick 101 on what is family medicine. Is it new? Is it, been around?
Family medicine is relatively new. It started in the late 60s, and there were a few specialty programs, and it has grown where now it provides the bulk of primary care around the nation. Boston's still a little bit behind. We had 3 medical schools for many years, Harvard, BU, and Tufts without departments of family medicine. Harvard's still without a department of family medicine, but UMass pioneered it. And
what is it? Once again, is it primary care?
It's primary care. So it's, people need their annual checkup, their regular checkup. They're sick with a cold, they have a rash. We do kind of full spectrum things. So we have family physicians that are delivering babies. We take care of children, for all their well visits and their sick visits. Get them vaccinated, keep them well. And really that's, a big part of family medicine is trying to prevent chronic illness and then when people do have chronic illnesses, then help them to stay as well with them as possible.
So do you focus on the delivery of medical services to the family, like all the members of the family, or is just, what is it? Yeah, why the word family? Because it sounds like it's just individuals in a family.
Well, we do. We have a focus where we can take care of the mother and her husband and her children and her mother.
Right.
And again, one of the other pieces. And when you're looking at preventative medicine, often you need to involve the whole family in keeping people well. I talk about family medicine also being a specialty where we're doing it within the context of the community that people live in.
Okay.
So we're also doing community medicine. So one of the first things our resident physicians are learning this month as they start their 3-year program with us is to actually be out in the community, see what the resources are in the community, who's there, what are the pieces and areas that we can help people be healthier, and what are the resources we can get people connected to if they're not aware of them.
You have to slow down. You introduced me to family medicine, now you're saying community medicine. So break it down for me. What is community medicine?
I mean, community medicine is, again, in our context within the Dorchester and Boston area, we have multiple communities, obviously. But each of them has some unique kind of health care needs, and trying to, again, know how we can help people within their own diet, within their own kind of family structure, stay well and live as long as they can.
So you notice certain things like prevalence of, say, asthma or diabetes in a community.
Right.
And so you begin to look at what's happening, what may be some of the causes, some strategies for prevention as well as treatment. And you're looking at a sort of like a large level, not just the individual, but what's going on in that community.
Right.
Is it prevalence for example, if you have alcoholism, which is another topic altogether, but if you have a lot of liquor shops and you have a lot of addiction, well, you probably will realize that there's a community issue, health issue here.
Absolutely, and I think a big issue for us is actually access to healthy foods.
Right.
So really promoting, again, healthy eating, being able to get people getting more physically active, using the Dorchester Park and going for a walk, can really keep people healthier. Right. And really that is a piece of it. And we do know that certain populations do have higher incidence of diabetes. So how can we prevent that? And so again, eating well, getting exercise really makes a difference for people.
So what is the real need and driver for the development of family medicine, and why did Carney Hospital feel it was so important that we need to engage you, Dr. O'Grady, in starting this program?
So again, one of the things now that we have almost everybody with health insurance, we try to get people connected to a primary care physician, because if we have them connected with a primary care physician, they're less likely to go to an emergency room for something that could be treated easily in an outpatient setting. So it reduces costs some. Okay. And then certainly for many businesses, that's important that we try to figure out ways to keep the costs down. We know if people are connected with a primary care physician, actually their health care costs are less, which is good. Hopefully we also keep them healthier so that they don't need hospitalization down the road. I think the whole idea with Steward's healthcare system is to really look at ways to keep people in a sense in the place that's most appropriate for them, and often that is less expensive if we can do that. So if people end up in an emergency room for a sore throat, which could be seen in the office, it's going to be a lot more expensive.
And it's funny. When you're young, you think you're invincible. You're not going to get sick, and you don't think about these issues. But I have an embarrassing story to confess. It's a real story, and I hope my brother is not watching. But I borrowed my brother's car, and for many months I did not change the oil. The red light went on, did not change the oil. Red light went on, drove for weeks, and then one day there was smoke, and the engine just went kaput. And so I took it to a mechanic, a repair person, and they said, hey, it's going to be to replace the transmission, it's going to cost you probably twice what the car is worth. So that was years ago. It was not it was my brother's car, but he's gotten over that now. And it's a reminder, I think, of what you're saying, and that is if you don't do maintenance of your health and your preventative stuff, that you're going to end up in the ER, and it may not be treatable, it may not be reversible, and it may be much more costly to you and to society, and certainly to the insurance companies.
Yeah.
And so this is, one of the ways that we keep costs down and keep people healthy. Is that right?
Yeah, I mean, if we can prevent cancers, and there are a lot of cancers we can prevent diabetes. And again, that's, now one of the biggest costs in this country is the treatment of patients with diabetes. And lots of communities are seeing more of this as, again, we have this epidemic of obesity now. Mm-hmm. And people are less active. Mm-hmm. We've got lots of screens to be watching things instead of going for a walk. Right. So I think those things can be prevented, and way better to prevent them. And again, the quality of people's lives is much better too. And as life expectancy actually has continued to increase, we have this opportunity to keep people healthier as they age too.
And people are living longer.
Right.
We're not sure what their quality of life is, right? I mean, you doctors are keeping us alive for an extra 10 plus years, but in some cases, people aren't necessarily healthier. And so the question is, how do we also keep them healthy so they can actually enjoy their life? Now, let me ask you, I mean, if this is, to me it sounds obvious. You're really doing what I think doctors are supposed to do, which is make sure people are healthy and prevent the disasters. I mean, there could be a partner in preventing you from going down, the path. But for many of us, I mean, it's not easy to access, healthcare, and it's expensive. There's deductibles. For Vietnamese Americans, especially newcomers, language is an issue. Often intimidated. Drugs are expensive. We don't know what's covered, what's not covered, and for very practical reasons, be they language, culture, money, they don't pick up the phone. They don't go to the hospital. What do you say to people who are putting it off for all those reasons?
Well, I really think the important thing is to know that it's actually pretty easy to get in and get a new patient appointment now with a practice like ours, which is an issue. We do have translators and medical assistants that are bilingual in English and Vietnamese.
So language shouldn't be a problem.
Language should not be a problem.
If you don't speak English, Spanish is your language, or Vietnamese your language, chances are you have somebody.
We do have somebody.
Okay.
And again, that's one of the things that I also have championed at Carney Hospital, is that we really become a community hospital that really welcomes people, from all backgrounds, and many, people who are only speaking their native language still. They haven't learned enough English to feel comfortable getting healthcare in English. And so, having somebody who can help them with, some of the complexities of.
All right, so you got language down. How about cost? I mean, if someone's like, hey, I maybe I have insurance, maybe I don't, maybe I qualify, maybe I don't. Better off not to take a chance and go to Carney. What do you say to that?
So we do have financial counselors to kind of help people through the process, because again, getting insurance sometimes is a little bit of a complex process. So we do encourage people, and it is required that people now have insurance throughout the nation, and so we're trying to help people, kind of understand how to do that, what's most affordable for them, and again, if it's a young person, having a little bit of a deductible might be a good idea, because they're not going to be on a lot of different medications. For the most part, they'll be relatively well. If you are somebody who has, some chronic illnesses, you might want a plan that's going to cover all your meds, so that that's
So you're
something
saying
you can do.
Carney,
And you have choices.
Okay, so Carney staff will
Help you navigate the system.
Navigate the system is
Right,
important. Okay.
yeah.
So that you're reminding us that you're required to have health insurance, and the state is set up to help you no matter what your financial circumstances, to help you be able to have coverage. That's the whole idea of all these recent reforms. So yeah, it's easy to say, don't worry about the cost, we'll figure it out kind of thing, but you actually will have people who help people navigate.
Yes.
What if, and this sometimes happens, what if you just flat broke, you have no job, you barely have enough to pay the rent, but then you fall ill. Carney Hospital is across the street. Should I walk into Carney Hospital anyway? Will they shut the door? Or?
No, absolutely. We're going to see you, and and again, hopefully get you well so you can get back to your work. Because being ill is actually one of the biggest reasons people do end up in poverty, and so being able to stay well and keep a job is very important in actually staying well. For the younger group, I also say staying in school is very important for staying well, and we know that people actually live longer if they can get some college education.
So now that we have a little bit of context about Carney and what you do, what can you tell me about some of the priorities right now, but both from when you just started the program and today, sort of 4 or 5 years later? What are some things that you're working on that will really help increase the delivery of healthcare to folks in our neighborhoods?
Well, fortunately we did get this family medicine training program accredited, so we have a training program now where we're
for residents
for in family medicine. So they provide care with a teaching attending. We're a Tufts Medical School faculty, so that we're able to provide more care in this community than we had in the past. And
how about some numbers? How many people are in the program? And
so we have 18 resident physicians now, and another 7 attending physicians as part of the team. So
and how many? Carney is actually
huge, right?
Like 300-400 doctors.
It's a big multi-specialty group. We have primary care internists. We have multiple specialists. We've got intensivists, pulmonary doctors, cardiologists, urologists, surgery, and then psychiatrists too. So we have a pretty robust psychiatry department within the hospital too.
Okay,
and
that's very important.
Helpful.
That's very important to know, because a lot of folks, especially in the Asian community, we don't really have a good attitude about mental health. I mean, we don't have a culture that really encourages people to seek out mental health, and it's good to know that Carney also has a mental health division. We only have a few minutes left, but I wanted to sort of ask you, there's some connection also with your partnership with Tufts School of Medicine. Is that something that?
Yeah, so all of our attending physicians are actually faculty from Tufts Medical School, and so they're both seeing patients at Carney themselves and teaching medical students from Tufts, and then our residents are in a program that is affiliated with Tufts Medical School.
That's great. And Tufts is, of course, one of the premier medical schools in the country. So that really ensures that some good talent are coming down to Dorchester. I think you mentioned a few important things. Like Carney is really one stop if you need one-stop shopping. If you whatever medical problem you have, you can probably get it fixed at Carney. You have language-friendly staff, so don't be afraid. You have folks financial advisors that will help get you set up. So whatever financial situation you're in, we'll probably help get you covered one way or the other. And even if you don't, in the most dire cases, you still will take them.
We'll see
probably,
them.
right?
Yes, we
And
will actually see them.
I read
yes.
an article in the Globes a few years ago where Carney was one of the highest, was the top of the list for providing health care to the truly disadvantaged that don't have any resources. I applaud you for that. That's not a list you not necessarily want to be on from a financial point of view, but we applaud you and we thank you for.
Yeah, I mean,
for
we want to be there for the whole community,
Yeah.
and when people are disadvantaged, we're there for them.
That's terrific. Is there anything else that that you'd like to know? I mean, we're very excited about family medicine department. I think it's really just going to bring another focus of care to families and to the community. And I think that kind of approach is very exciting. Is there anything that we haven't covered that you want to share with our
Well,
audience?
just that, we have expanded hours now too, because
Okay.
a lot of, another piece of, being accessible is actually being able to, see people in the evenings when, they work during the day, so they don't have to take time off from work to be seen. So that's something new we've, added, and again, really, I think that's important in this community, because losing the day of work is difficult for a lot of people, and we're again trying to get them to get into healthcare, stay well, so they can keep their job.
Well, terrific. Well, Dr. O'Grady, we're very happy. We're delighted that you have taken this type of approach and to ensure that our folks in our community are healthy and that our community is healthy. For our audience, tonight's topic has been about Carney Hospital and the new family medicine initiative, and just to revisit how important it is that we take care of our health, both in our family and our community. We'll have Carney Hospital representatives back to talk about some of the other things that are going on at Carney Hospital. We're very pleased that they've been a good neighbor. So that's it for our show tonight. We want to remind you that if you want to tune in again, if something I said or Dr. O'Grady said that you didn't understand, well, don't watch it again. We probably won't understand a second time, but I'm kidding. We're going to be broadcasting again Sunday at 5, Monday at 1, Tuesday at 11, and this is VATV, and our number is 617-708-3290. If you have any questions, comments, or suggestions, thank you for watching, and we hope to see you again next week.